Hi, so again, welcome to this workshop. This workshop is intended to be an interactive space for all of you to share your experiences and things that you've been hearing during the GCNF forum, as well as your own experiences in your respective countries. In terms of the agenda, again, as Sung mentioned, we're slightly modifying this. And so instead of having breakout groups, we will use this presentation as the framework for discussions, but I think we will all stay together in this main room to have our discussions as we go through the presentation. So we wanted to share these two resources that we will be using to frame the discussions in this workshop. The first one on the left-hand side of the screen is a UN document that has considerations for governments to make decisions about how and when to open schools safely. The one on the right, the Safe Back to School Practitioner's Guide, which was developed by the IASC Global Education and Protection Clusters, really builds on the UN framework and provides concrete actions on how to operationalize it. So how to think about supporting children's health, safety, and well-being as school systems reopen, but also helping schools to prepare for future closures. So we're going to be using these to kind of frame the discussions. The links are on this presentation, but they were also included in the workshop description. We're interested in knowing a little bit from you if how many of you have used these guidelines in your work, or if you've found them useful. So, Sung, do you want us to do the polls, or should we just open up a discussion? Has any?
Either way.
Proceed.
Maybe we just do the poll because people can respond quickly and then see what happens. There we go.
Okay. So it seems like most people who were able to answer the poll have not seen these documents before. And one person has at least reviewed them. So, you know, again, we have put the links in the workshop description. I think that these are really important documents. They're very comprehensive. The Back to School Practitioner's Guide also has a series of checklists, which I think are very useful in terms of thinking about how to support schools and how to support education systems on areas such as school health and learning. So, I
just want to say, I think Anne's going to go over some of the basics, what's in there. If you don't get anything out of this session except the fact that you now know about these sources and then that you can use them, that I think is worth, because again, these are really useful tools. And there's nothing like for us new in them, but it's the fact that they've been put together with the context of COVID. I think that alone is probably worth you joining us for this session.
Yes, and they are available in multiple languages as well. Okay, so both of these documents, as I was saying, are very provide guidance for a holistic response. So they're really looking across the sectors of health, nutrition, and WASH, learning, and well-being and protection. MEAL, monitoring, evaluation, accountability, and learning, is cross-cutting and supporting the work in these other sectors. All of these are key for the safe reopening of schools and for supporting children's overall well-being. The guidance also looks at what should be done before schools open, during the period of reopening, and once schools are open. So, one thing we were interested in hearing from all of you is whether, how schools, if schools have already opened in the countries where you're working. So can we get that poll to kind of see where people are in terms of whether the schools have opened or not?
Can we answer vocally also?
Sure. If people are happy to take off their mics, their mute and share, that would be great.
Okay, well, my name is Patrick Swan from Quebec, Canada. So the transition from my children's schools, very smooth, very cautious, very respectful too at the same time. I find the population of the experience of my school reopening, parents really took the care to listen to the guidelines, masks going right up to the gate, saying bye to your children, dropping them off and going into school. At this point, the school hasn't had no cases, no closures that in the past. So it was a very good transition, but it came really down going by these simple standards of distance, mask, and drop and go, basically. So it was a very good transition within my environment.
Great. That's good to hear. Would anyone else like to share what's going on in their countries?
This is Newton, and I work for Nascent Solutions. We're implementing school feeding projects, as I mentioned, for example, in Malawi, and schools are reopening. So measures are, they're in the process of being opened, I would say. Measures are being taken to ensure that this is done in a safe manner, masks, sanitizers, social distancing. So it's I think I am not the one who is in charge of education, but I know that this is a work in progress. The focus is that this is done in a way that does not expose students or teachers to COVID. Thank you.
Great.
Country context in Myanmar, COVID-19 cases are still increasing, especially in our Yangon city. So, firstly, we plan to open the school, and we start to open the high school, but after that, I think in August, a second wave of COVID-19 started, and we are still in increasing trend. So we can open the school now. But some international schools are opening with the online learning. Now, most of the governments, all of the government schools are still closing. Yeah.
Okay.
And it's Jessie here from UNSCN. While we can't because we work at the global level and the UN system level, it's not professional experience, but living in the Netherlands, I can say the schools were closed in the initial lockdown around April, but very quickly opened up again. And at first there were a lot of protection measures put in place, but now that's definitely tapered off, I would say. And as we go back into the second wave, there is a lot of concern in the public about those safety measures and about what the children might be spreading to adults there. So they're all back, but yeah, definitely concern about the safety measures for both the students, the teachers, and then the parents they're interacting with also. And I guess also from my home country of New Zealand, a positive note, while there were school closures, once they opened up again, it was an extra drive to start up school feeding programs. So there was a positive note out of the COVID lockdown.
Great.
And since I can share I support some countries myself directly, and most of the countries we support through the USDA funding for school feeding, for example, the schools have stayed closed. And I support Malawi and Guatemala and Sri Lanka. And there's been the shifting of timing of when the schools will reopen. And each of the schools are looking at different hygiene messages. So there's take-home rations and then trying to make sure those are being distributed in a hygienic and safer method. At the same time, adapting how we deliver other messaging, other learning. So that we're going to talk a little bit about that, but a lot of the countries that we're supporting, they have been shifting their reopening process. So again, Liberia has now finally decided to reopen their schools in December, but it's been closed for the past several months. Similarly for Guatemala. I just want to share some of the experiences I'm aware of.
Okay, great. So I think this gets to something that Jesse had said. To date, global data suggests that children under the age of 18 represent fewer than 10% of all reported cases, and relatively few deaths compared to other age groups. However, the extent to which children contribute to transmission still remains unclear. So that's something that schools need to consider. Because of that, health and hygiene precautions and preparations are critical. As indicated on this slide, some of the actions that are proposed by the two documents we showed earlier really focus on wash facilities, safe food preparation and distribution, and changes to health protocols. So again, to talk a little bit more about this, we're interested in hearing which of these have been the most challenging, and maybe if you have any examples of really solid responses to any of these. And you can put up the poll, Sage. Okay, so from the poll, it's pretty spread out evenly in terms of which has been the most challenging, although slightly more votes for safe, adequate, and accessible water, toilets, and hand washing. Sung?
No, I was going to share some experiences. If anybody else wanted to share experiences. Since I'll just jump in. We've been working on hygiene messaging for past decades and decades. And what's interesting is, I think I mentioned this previously with the COVID thing, there's a new interest, and I found it a little bit frustrating that all this new desire to have new hand washing messaging when there's so much out there. So I think we spent a lot of time actually saying, instead of creating new messaging, could we just find really good ones that exist? Like Sesame Street has been doing hand washing for younger children. There's so much out there. So trying to actually bring that together. And I know at Save the Children, because there was so much materials out there, what was interesting was that a lot of the practitioners were basically like, we know it's all out there, just give us the one document that's the best, because we don't have time to go through all of this. And of course, it's one of those, we're always caught in this like, well, it's always best to adapt and make it fit for your situation and your cause. And we don't want to just give you something that's not preset for your context. But again, hand washing is not a new concept. It's soap and water and you scrub certain parts. And so I think that was one of the reasons it may have been difficult, is that we all know how to do it and we have so much material. So it's just getting it out there in a way that's actually changes behavior. And I think within this health education messaging, that's the other frustration. Every time there's a crisis, there's an Ebola crisis, there's a cholera crisis, there's a renewed interest in hand washing, but how do you keep that going beyond the crisis? And I think School Health and Nutrition, we work really hard to teach the basics of hygiene and health education throughout, whether there's a crisis or not. And it's just trying to make sure that people recognize this is an ongoing intervention that seems extra critical now, but we want to make sure that it's a message and it's an intervention that we continue regardless of whether there is. So it's finding the right balance. Like, yes, this is really critical because COVID is, it's linked to hygiene, but let's not let up on the gas just because the pandemic is over, because we do that after Ebola, we do that after cholera, but no, this is like a lifelong message. So those are some other frustrations, but it's based on like long-term learning. So I'm going to stop. That's my contribution. Reactions, comments?
It's Jessie here. Just to reiterate what you've just said, I think that can apply to the nutrition agenda as a whole. And a lot of the COVID responses, we're saying these aren't new interventions. We're not calling for new actions. We're calling for strengthened actions of the same messages there. And just to reiterate, in the Pacific Islands, exactly what you've just said. Every time there is a cyclone or a natural disaster, we're having to immediately send out the same resources with the same hand washing and hygiene messages. So yeah, the ongoing emergency cycle.
Jessie, are you still there? I know you said your Wi-Fi was in and out, so we just lost you for a sec.
Oh, sorry. Yeah, just emphasizing that that ongoing cycle. So I'm not sure where I cut out, sorry, but in the Pacific Islands, each time there is a natural disaster, we have to immediately send out the same resources that are still with those same messages: wash your hands, take care of hygiene there. No need to even revise the resources we're sending out. It's exactly the same messages. Just, I guess in a way it's harnessing the emergency to emphasize the message, but I completely sympathize with your frustrations there that we have to keep doing that.
May I also mention that the emphasis on washing hands and keeping a clean environment has reinforced the fight against, for example, cholera outbreaks in some of the countries in Africa. So this is something that we need to keep up all the time, because it does not only address the COVID issue, but also other health related issues, including cholera. Thank you.
Patrick, did you want to jump in? You unmuted yourself, or?
Yeah, I was just wondering, from your opinion, to get a specific standard, because obviously we have school facilities we'll probably focus on first, and the standards across, I guess, the world is not equal. what's missing linking this great information to the front lines to get at specific standard? Do you find that there's a lot of politics in between to get that clear message out? I'm just wondering what do you think is the struggle stopping you to get there?
Well, I think, I would say resources. I'm going to go kind of address the question about standards. I would say 10 years ago, there weren't. I've been working on school health and nutrition for some 20 plus years ago, and I would say the Ministry of Education did not have standards for WASH in schools 20 years ago. But now it'd be really hard to find a ministry that does not include WASH facilities. So that's a plus. But if you go dig into that and see what is actually in those WASH requirements, the standards are mixed. But about 5 years ago, we did come together as a global community to actually set standards for what do we mean by the basic minimum standards for WASH in schools. And UNICEF and WHO actually track this, and they've actually, this is the 3rd or 4th year now that the JMP, the Joint Monitoring Program, is tracking that. So we have a better sense of how many schools globally actually have the standards. And the standards talk about some basic things, not just facilities, but that's there. Like, when we say minimum standard, it's not just water faucet, but faucet that actually has water flowing from it, and that there is actually soap at the hand station, and that it's there when there's a random visit. So it's actually, those standards have become a lot more defined. But if you dig a little bit more, we're also now working to make sure that those standards are there, but who's actually meeting those standards? Are there government budget line items? Budget line items, or for example, bringing it back to COVID, is there actually a budget line item for cleaning materials? We say schools must clean, but some of the schools actually have not thought about the cost of cleaners, staff people, but also the materials. Is that in place? So that we're working down to these levels, and I think that is one of the issues, that there are not enough resources, but also, as you say, the standards and what do we mean by minimum standards have not been uniformly understood. But I do think those are now in place, and those are resources that are available. And the meal part of this whole discussion, once we start tracking, more and more people are aware. So now that we actually have this global indicator and global monitoring from UNICEF and WHO tracking and asking the ministers of educations to actually track how many schools have the right minimum standards, that will increase the resources flowing to it, and to have people understand it. So I think those are big pieces of it. Referring to the health messaging, I think I do want to go back to the curriculum, like having the right curriculum in place. But we also, there's a lot of behavior change educators. We're actually looking to see what is the right messaging. How much, this was, for a long time, there's a desire to do medical information, and that has been proven that it's not the knowledge about health. It's like telling smokers to stop smoking because it's bad for you. That doesn't work. So understanding what are the triggers for behavior, and we've worked in many ways of looking to see how do we deliver messaging. It's not just the medical piece, but also vanity, like wanting to be clean because it makes you look nicer or likable. So different ways of triggering behavior. We've also worked on behavior nudges, saying that it's not just messaging, but just giving little cues to remind people. And I think, again, COVID-19, seeing pictures of hand washing, it's not, the messaging is important, but now just having those signs at the hand washing stations that trigger people to do the washing and so forth. So there's a lot we're learning, and those are some of the pieces. And again, so you asked my opinion, and there's a lot.
Yeah, exactly. And I also see just by your words, and it's fantastic because there's the light at the end of the tunnel, and we have the answers. And what you're saying, like also like sports facilities, you know what I mean? Like my old life was aviation, and the standards were very precise. You had to follow the standards, or else the aircraft would not fly. basically. So with the Breakfast Clubs of Canada right now, and what your words are saying, we have a great food system program, but also we're touching schools too at the same time. So I could see a very nice link of trying to see the standards of our education system and going through the ministers to get that information of why do we not go by these standards. So your comments were fantastic, definitely, and very education. Thank you.
Yeah, and I mean, I think also with, COVID and governments trying to make the right decisions about when schools can reopen, they are also making those decisions for entire, departments or provinces at a time without sort of understanding which schools don't have the facilities in place. And without any added investment of, okay, then we need to invest in this, infrastructure first before we expect these schools to open. So I think that's a challenge that's been really highlighted by COVID. The other thing around messaging, I would just add to what Sung was saying, is, for behavior change to work, the message needs to be heard by multiple audiences through multiple points. And so it's really thinking about that. And if children hear and learn that they need, and they have this behavior at school, but they go home and they aren't practicing it as well, and they're not hearing the same messages at home, then it makes for a much slower or less effective behavior change initiative. And so it's really thinking about those different entry points. And as Sung was saying, the motivators, what would motivate that particular audience to change that behavior? So getting very sort of nuanced about that, I think, is really key. And then the sustaining that over time, I think, is really critical. And I think we saw that in sort of the post-Ebola period, that a lot of attention had gone to washing hands and hygiene. And then as the Ebola crisis passed, some of that, faded away. And so the question of how to just keep this front and center, I think, is a continuous challenge.
So, in my opinion, I think sustaining the messaging and the actions are really key because in many countries, generally, there was a good start and then people relax. I know that, for example, in my country, Kenya, a lot of people initially had all these measures in place, like sanitizers, soap, running water to keep hands clean, masks. But then at some point there was relaxation, and I think probably this could also be the case in the school. So really the messaging has to be persistent and people have to be on course so that the gains are not lost. Thank you.
It's Jessie here, just to support what Newton just said, that relaxation of measures. If you look at where the participants are from here, I think we cover all the world, and I think it's been a global relaxing of the measures. At first there was the high anxiety, and now everyone's just a little bit fatigued there. But also, just to give a little bit of credit to the teachers and school kids, that's the group I've seen the messages carried on the most. It's my nieces reminding me about hand washing and covering mouths and coughing and things. They really are a population subset that carry that message and promote that message and pull up the adults who aren't complying on it.
Jessie, thanks for adding that, because one of the things, and I think we've been focusing a lot on COVID messaging, but I kind of stepping back on the whole school health and nutrition activities. one of the most popular activities that we do is actually trying to get the children to be the action taker, the messengers, the agents of change, as we say. So they get to carry on the messaging, like just like you said, not just during COVID, but when we have health and nutrition and other lessons, one of the things we try to get the children to do is actually share it back to their families and to reinforce their own learning, but to make sure that it's not just beyond just in the schools, but actually in some of the communities we work with, parents didn't get the messages, or they're not getting the continued information that the children are getting from schools. I think really looking at children as agents of change, and I think it globally really recognizing that children can be, they're not just receptacles, but they are actually, they can do things. And we have a lot of activities where, again, they're the leaders, they go out and work with the communities and they work with the families. So that's a good practice that we would want to continue with school health and nutrition in general.
Before we move on to learning, would anyone else like to share, or have any of you seen something particularly innovative or successful in terms of health, nutrition, and WASH as your schools and your countries are reopening or preparing to reopen?
For myself, the process basically, the children enter the schoolyard and there's somebody with a disinfectant bottle of gel, and they get squirted before walking in, every student. And my son does say they wash their hands like every recess, every lunch. So I think they have just making sure that don't put your fingers in your mouth and making sure your hands are clean. And the prototype is really working well. Like, we haven't had any cases internally. So I think that's where keeping it simple. They're children. They don't need too much information. Like you were saying, they're intelligent, and we just have to trust their knowledge too. So they're learning at the same time as us. So they're probably quicker than us, but keep it simple. That's basically what my experience is right now.
Great.
And just to add, the biggest visual thing I've seen is well, first of all, there's the different drop-off times for schools, but also the plastic dividers seem like such a sign of COVID, and they're all through the schools in the Netherlands there. So yeah, that's something that really stands out.
I'm going to share an example that we discussed at the last session for schools that remain closed. And I think and I just got news from our colleagues in Indonesia, for example, they will be staying closed through next June. And similarly for Sri Lanka. So I think we have some good examples of schools that are reopening, but there are schools that are continuing to stay closed. So for the school feeding nutrition piece, take-home rations become more and more important. And I give examples of these countries I support, but we actually, SAVE also has programs in the US where school meals are critical. So during the summer months, having take-home rations, or I guess, I don't even know what we call them in the US, but having those meals to take home is yeah, those are really critical. And last session, we talked about how do we make those meals even more nutritious. We know that we are packing basic USDA commodities that we used to distribute them in and make them into meals, but now we're packing them into take-home packages. And we talked about maybe including recipes for parents to use. We're based on working on nutritious meals that's delivered by school cooks. So the recipes may not be actually that different. It's just that we would want to adapt them for parents who are taking the rations home now. And it may be added burden. I mean, to be honest, like if you're suddenly being asked to make meals that kids used to eat at school, it's great that they're getting the actual produce and the commodities, which is critical for their their household, but now they have to cook the meal they hadn't. But to recognize all those barriers, but to make it easier, maybe to include some recipes that actually make it more nutritious. So that was something we talked about, really adapting to the school continued closure. So that's one example. And we also always include the hand washing messaging with all the take-home rations. And Anne's going to present about education. So I will share the other example about school closures, what we do for education in the next slide. But I just wanted to share that because there are a lot of school systems that will stay continued and closed as opposed to reopening.
Okay. I think everyone has heard the statistic that because of COVID-19, almost 1.6 billion learners and over 63 million teachers were affected by school closures. The biggest challenge, I think, though, is that all of these school closures have really highlighted and exacerbated inequities in school systems. The two resources suggest some of these actions to support learning and to ensure continuity of learning even during closures. Digital infrastructure, teacher capacity in areas such as remote learning strategies, assessing children's learning levels, and responsive pedagogy, and also support to caregivers in home environments have become even more critical in this context. I think that these are challenges, but they're also opportunities to make long-lasting improvements to the ways children learn, even after schools reopen. Sung, did you want to share something?
Sure. And just for everybody, Anne and I are trying our best not to jump in to give you guys a chance to say something. Otherwise, I can talk, warn you. But just to give an example, I just mentioned Indonesia, and it's interesting some of the activities we're doing, and it's not just Indonesia, but for example, the lack of internet. I think we are so used to a lot of the resources being online learning, but we are working in many countries that's not available. Yeah. What is interesting for Indonesia is that they don't have computers, but quite a lot of the population have smartphones. So we're actually just buying data credit for a lot of the communities that don't have enough credit for using internet resources. But that's already speaking to a higher level of resources. For the lower level resource communities that don't have smartphones or anything, we're really going back to the basics, creating and printing out weekly lessons and distributing the paper versions of lessons and lesson plans to communities. So again, this is learning materials that we would want to provide in classrooms. Normally, we do a lot of work in textbook provision, but actually going to another level of providing weekly lesson printouts. And then one of the things we're trying to do is actually grouping the teachers to go visit communities. So recognizing where students are actually coming from, the households that are nearby, trying to get them to actually sit in a classroom or in their household of 3 to 5 students, and teacher actually going to visit the school in these small groups to be able to deliver what they should be working on next week, and providing a little bit of a home. So it's something I think turned upside down, like, parents, teachers actually visiting households where they have a few of the students sitting together to avoid the big groups of schooling. So that's some of the adaptations that's going on. That's my share.
Yeah, thank you, Ms. Lee. I also had attended the first international conference on food and nutrition from Samuel, led by Samuel Refron. So at that time, I also have the they are programmed for Genboard. Yeah, Genboard, as you mentioned, that they make their they're using the smartphone to continuous learning for the remote area, or if they have lack of internet. Yeah, but how poor we are, yeah. Our country, we have not yet that kind of program. So our school children still cannot access for the continuous learning. Yeah, we should, yeah, because we have some of our not almost all of our government school have not enough facility to make the online learning or also something like that. So almost now 1 year, they do not have the continuous learning. So if we can provide some resources for the hand washing and suppose and face mask, it may be better if we can reopen our school sooner. Yeah, because our friend, most of our country, we have the 70% is rural area. In the rural area, and school are just in the village, especially for the primary school, and they are well ventilated, and the school children are really united in one village. They are already related, so it cannot be. And the COVID-19 must not be in, how can I say, uh, can say obstacle for their learning. Yeah. Thank you. Okay.
So radio?
Radio we have, but how can I say, for the primary or middle school children can usually not used to be, not familiar to just learning for the radio. Yeah. Maybe we should, yeah. But our government also trying to share the same educational program by TV or radio. Yeah, but some area we have no electricity, and their family do not have television or something radio or something smartphone.
Yeah.
And at that time we need to provide some paper-based facility, and but for that kind of for my concern is for the poor family usually live in the small village. Yeah, they just in the primary or secondary school, they only have 50 or 100 school children. Only 2 or 4 or 5 school teachers. I think at that area they can step for the continuous learning. Yeah, for the school children. I really worry about for the dropout or something like that. Or now already 1 year skip. Yeah.
Yeah.
Okay. Thank you. Yes.
Yeah. I would like to add one thing. You are asking about the radio program, but I think we can run the radio program for online learning, but I think it cannot totally support for the teaching of those school children, because it's only for 1 week. So for online learning, for in our country, most of the international school run the online learning program with the computer like that. So I think if we can use this kind of online learning, it will be more useful. But for in our country, we can provide all of the school around the country. So this is one of the constraints.
Yeah.
But we're trying to do it. Yeah.
I think, I mean, I just want to jump. So I gave some examples from Indonesia. So our program in Malawi, it's a mix. So I think one of the key things is that none of these methods of continuous education is sufficient to meet all the needs. I think it's a mixed method. So as examples, online with handouts, with teachers visiting. So in Malawi, their schools, unlike the schools you described in Myanmar, their schools are overcrowded always. So for this, they were also bringing students back only with certain classes to limit the number of children actually in classes. But those others who are not in classes are getting the radio messages. But what was interesting is that because, and we're not even delivering the radio messages, lessons were not aware, all the students were not necessarily aware of the schedule. So it was interesting, the government had put out the radio lessons, but they hadn't share the scheduling to the community. So teachers and students weren't even aware that the lessons were out there. So sometimes you have the right resources, but you haven't done the basic of informing parents and communities that there are these lessons. So what we did was support the ministry to actually have handouts at the schools to give out to parents to say, here are the homework, the worksheets, and here's a schedule of when the radio sessions will be happening so you can listen in. And then the teachers are also equally stressed, and they don't know, and there's all kinds of support for teachers for their well-being, but beyond that, their ability to actually support students and work with these radio lessons or work with the online resource, they're also very limited. So also trying to help teachers adapt. And I think this is kind of, again, going back to my previous message, there are a lot of communities in the past that we've been working on to reach them through remote learning, because they're just remotely, it's hard to reach them through basic conventional schools. And we've been looking to see, how do we help teachers be better at delivering message? How to help teachers use radio lessons? And I think all the studies indicate that it's not just delivering the radio, it works best if you can have a facilitator. Yeah. Are there others, teachers or community members or parents who could do some of the facilitation? So there are different methodologies, and unfortunately, really reaching the hard to reach, you have to use different methods, and understanding better who's available, and looking beyond the teachers and students. And another example, in Afghanistan, we used teenagers who are older and had spare time. We used them as facilitators to work with younger children. So looking at different solutions out there.
Just to share also the example from Estonia, where I think they made internet access a human right. And so they've been able to really excel in this time with making sure that online connection for students is still there. And I just thought it was an interesting avenue that, it's something often we don't think about in either nutrition or education, but that online access and using that as a human right, I thought was really interesting.
So I think that the challenge is always understanding that different communities and different areas need different levels of support on that level. And then different children also need different levels of support, and how you help teachers in schools and families understand that point. So which are the children who are most at risk, either of not coming back at all, or at having not been supported during the closure, so that their learning levels are significantly lower, and then they will have challenges once they come into the classroom. So I think, all the way down the line, kind of thinking about how these things are different for different children, different schools, different communities, that's what's going to make the education system successful in its response and building a response. It's not going to be one size fits all.
Yeah. Of course, we need to find the positive ways to be the fit for the local setting. Okay, thank you.
Going back to your concern about children dropping out because they've missed so much, and I think that's actually something that the education sector in general have looked at different solutions. And I think this just exacerbates some of those, it increases the number of children who might drop out because they're unsuccessful or the communities or the families don't have the same economic support. And actually, yes, go ahead.
Yeah. That's really, because for the poor family, if they have the now COVID-19 pandemic, they have the loss of job or something like that. So we see some and some children are working for their family, yeah, of course. So I be worried about for that point also, for the poor families and poor school children. Okay. Yeah. So we need to support all aspects for all different levels of the.
Yeah.
Okay.
I think that actually leads really well into the next section.
Yeah.
So the last key sector covered in these two guidance documents is around protection and well-being, which I think has really taken a central priority during COVID. This graph on the right-hand side is actually from a global Save the Children survey, and it shows how children have been overwhelmingly affected by negative feelings as a result of the pandemic. So what it shows is that more than 8 out of 10 children reported an increase in negative feelings. The disruption to their education and being out of school was one of the most significant stressors for children. And what this survey showed was that the longer schools were closed, the higher the level of reported increase in negative feelings, ranging from 62% for schools that had been closed just for 1 to 4 weeks, and going all the way up to 96% when schools had been closed for 17 to 19 weeks. So it kind of just shows how important it is to focus on the mental health of all involved, children, their parents and caregivers, and teachers, and to really think about children's protection and well-being and how to support this both during the school closures, but also as schools began to reopen. So one thing we were really interested in talking about here, and which came up in the previous workshop, was just that many countries sort of recognized this as being important, but hadn't really focused on it or incorporated concrete actions to support children's protection and well-being. So we're interested in opening up the discussion around this in terms of how you're seeing your countries and contexts focus on this sector. Okay, great. So everyone is either a high level of focus or somewhat focus.
Would the two people who said high level share what's being done? If you want.
Yeah, well, I'll go. I put a high level. Right now, as a father sending my child to school, I'm very aware, very sensitive of the information that our governments are feeding out there. And our Ministry of Education and Health, we're very clear and focused on how they're going to be able to manage the opening and how to sustain the opening also. So basically, like you're saying, wash your hands, try to stay away 2 meters, keep it very simple. So those small little details are coming out, and I think the parents are really reinforcing it also. So I think our government, Canada and Quebec, have been very forward on those goals and how to keep it simple and how to educate your child and be able to be happy. Even if you're by yourself, try to find different ways to be able to implement yourself also at the same time. So open up your imagination also as a child. I have 2 children, so basically they have a playmate when we were having COVID cases where we were closed down, so they were able to play with each other. But I did have parents that had a single child, so for them they found it really hard not to be able to have someone to play with, so they found different ways of doing it. And the government gave indicators. It's going to be a tough time. We're going to be isolated. try to use your imagination. So protection and well-being, I think our country, Canada, is doing very well. And my province of Quebec is also are doing a very sustainable work. And I think the cases were going up in that second wave. So you definitely see the waves, but the schools are still open. So I think if we didn't have that protection and well-being in place as a message, the number one message to be able to go against this COVID, I think our well-being and our government's doing a good job. But also we have to follow it and we have to be able to respect it. And I think that's the key indicators that we have. If we follow the regulations and the rules, everybody will be safe. And I think it comes down to the individual themselves to be able to find a way to be able to be protective in the situation and also self-motivate also. I think that's important too. So that's my opinion.
Have teachers been supported to support children in terms of understanding what the signs might be of children who have experienced trauma or have high levels of stress or anxiety? And have they been given sort of a playbook in terms of how they might respond to that and what to do if they notice that children are exhibiting signs of stress and or not even coming to school?
For myself, I'm not aware of what's the tools that are provided, but that's something I'll be definitely looking into after this call. Great question.
Okay.
I'm going to jump in, and then there are a few people who just joined, just to let you guys know that this is an open conversation. And if Anne and I, who are the co-facilitators, if we're silent, that means we're hoping for people to jump in. So do jump in. But I'm going to give you some examples of what has been done, what could be done. I think last session, there was a conversation where there was a group that had labeled school kit as a happiness kit, just labeling it as a happiness kit for people when they get their school kits to think about that piece. And based on that conversation, I gathered some examples of what we've been doing. We have activities in the past where we help children keep a journal. It's a self-journal process, and it was for not COVID related. It was I can't remember what the cause was, but it's actually really helping children recognize their emotions and giving them a venue to keep track of what they're feeling. And it's a tool that was used for a different cause, and we're thinking about maybe this might be something we could use and be as a part of the happiness or a school kit, is to include sort of a self-journaling option. The other one, we actually have a lot of post-war trauma therapy sessions where we use art. So we have a program called Heart, which is about using healing through arts. So helping do art sessions and drawing sessions where children again express their emotions through art and helping them deal with any negative feelings and being able to recognize that. So that's another tool. And I think it's going to be interesting how many of the tools we develop. I think, again, COVID might be one new item, but the actual reactions, stress and negative feelings, those have been around for different reasons, and we have solutions that deal with that. So again, we have a lot of tools that we have used to deal with post-trauma from war or other conflict. I think that's another thing to look at. And then going back to Myanmar's concern about dropouts, one of the things we have really looked into is girls dropping out in Malawi, because that's a huge issue. And one of the activities we've done is using buddies. Having a student, another child student that's successful, be the buddy of a girl who might be at risk of dropping out, or having come back from a situation, a pregnancy, for example, that might increase the risk of them dropping out, and having this other student help them navigate the school system, or to help them with homework, or to have a buddy to address and talk about issues. And that's a tool we're trying to use for in general for gender reasons, but again, it would apply to any student who is dropping out. I mean, that assumes there will be enough students who are healthy and are staying engaged. But I think there's also been studies that show that a student or a person who helps another person out, that increases their well-being. So that's, again, an example where we can borrow from other activities where we can help children stay engaged in schools. So those are my examples.
I think we need the social and welfare support
Yeah.
for the poor family and poor school children, and like conditional care transfer to the family, because we have some social welfare now for the 1,000 days children and pregnancy and lactating mother, and all for the seniority. And later on, if we can provide like the support to the poor family and poor school children, it can solve something for the drought problem also. Yeah, we hope. Okay, thank you.
Just to share, in the Netherlands, one of the big policy shifts has been that before COVID broke out, one of the big concerns was classroom size. So as a result of COVID, they've actually, readdressed that policy, and now teachers have less students to care for, which is, first of all, improves their mental well-being, but also following the lockdown, the teachers have better digital connections with the students, and that's allowed them to reach out to students in a private way to talk about their mental health when they see it slipping there. So it's an extra source of communication between the teacher, the parents, and the students. And also, just to say, they have really prioritized keeping sports and extracurricular activities open. And you see that everywhere through better use of green spaces. So you'll see classrooms using local parks rather than just the school fields to give more room, and all through the neighborhoods, actually. So I think, and actually a big thing since COVID has been seeing more children out and active, and with family groups also. So some positives.
Yeah, luckily our rural family and our rural school children have this kind of opportunity to enjoy this activity in the area. Yeah, yeah. Okay.
Great. We have 7 minutes left. So Anne's got one more slide.
Yep.
Okay.
So just the final one is the monitoring, evaluation, accountability, and learning, and how important this is across all of those other sectors. Really to understand how education systems have pivoted and whether they've been successful in supporting children in some of these areas, around accountability, to make sure that protocols are clear and communicated and respected, to provide opportunities for feedback. I think we were talking in the last group about an example that came up in a previous panel at GCNF about the app that was developed in Brazil, where families could learn in a very clear and transparent manner what the government had funded when it came to school meals, and also an opportunity for them to provide concrete feedback on the quality of the school meals through this app. So that was one example about how meal had been used to really increase accountability and to connect parents to the school meals, as those school meals were being provided, whether as take-home rations or as meals in school. But also the learning to kind of help schools build back better and to support schools to prepare for future closures. So what went well, what didn't go well, what could be improved for the next time around. So this, both of these documents have some guidance and some checklists around this area of monitoring, evaluation, accountability, and learning. So this was the final piece. Would anyone like to share about any of these elements that are here? What is happening in your context, or what you've seen that has been particularly successful in terms of assessing the readiness of schools or the health of children or the learning levels of children and how to use that to provide extra support?
In Myanmar, school meal program is in I think some percentage of the school because WFP provide the school meal ration. I write that for the school children living in the poor in the rural area and those children from the poor family. So in this year, before the COVID era, we conducted the guideline for the school meal program for the this year. But for the COVID, we can conduct this program. But we have also, I think we have already finalized this guideline. So after that, we will conduct the school meal program for the whole country by phase. But up to now, I have some experience in school meal program because I conducted the federal school meal program in primary school, and I disseminate my research to the community as school teacher and community. So based on those research, some school in rural area are running the community-led school meal program, and before the school are closed. So this year, I plan to continue this program with the support of the community and the local for the funding from the some local donor. So we have two school of thoughts for the school meal program with the donation and school meal program with the support from the government, and school meal support from the like WFP.
I realize there's only 2 minutes. Thank you so much for sharing that. But I wanted to just recognize that we only have 2 minutes left. And Anne and I wanted to thank everybody for participating and contributing. But if there's any last minute comment anybody want to make before we go, this has been recorded for anybody who needs to go back and refer to it. I'm happy for anybody, if they have questions about any of these resources, you can reach out to me directly as well. So any last comments before we say bye?
Okay, thank you for your valuable resources. I have made a glance and it is really useful. Although we have the readiness of the school to reopen and open, but this guidelines are also useful for us. Thank you. I will share to the authorities and authorities for the school help. Yeah. Thank you.
Thank you.
Thank you very much.
Thank you. Good night.
Yes, good night for me and
yeah,
anybody
we are now
else?
already 10 p.m. Okay.
It's lunchtime for us in the East Coast. Anybody else?
Well, just say, well, thank you very much. And I'd definitely be reaching out to you. A lot of different projects and information that you guys provided, extraordinary, and definitely helps me to be able to research where is that, do they know about the knowledge, and if we could use this already programmed system to implement it quicker than we're supposed to, because the faster we get this great information out, the faster we could recover. So I'll be definitely reaching out, and thank you very much for the information.
Great.
Great, thank you.
Yeah, and just to say thank you very much, as everyone else has said, and it's just been great to hear other people's experiences and learn more about what's happening around the world. So keep up the great work.
Thanks, Jessie, and for your participation, and Patrick too.
Yeah, thanks to all of you for your active participation. This was a really interesting discussion, and I hope that this was a helpful workshop.
And Anne and I have both put our emails in the chat, so if you guys need to reach out, please do.
Thank you very much.
Thank you.
Thank you.
Great. Bye, everyone.
Bye.